The number of children hospitalized for prescription opioid overdoses has more than doubled over a 16-year period. And now U.S. schools are launching aggressive campaigns to prevent the abuse of opioids and other medications among students. One of these programs is the Botvin LifeSkills training program, developed by Dr. Gilbert Botvin, who joins us now to discuss. Hi, Dr. Botvin. So great to have you here. What I find so interesting about your program is that it started out targeting another addiction, correct?
That's right. We started out with a focus on tobacco, so it was designed to be a smoking prevention program. And then after finding success in reducing cigarette smoking, cutting it in half, we then began to see a relationship between cigarette smoking risk factors and those related to alcohol, marijuana, and other illicit drugs. And so the program that was originally designed to prevent cigarette smoking was then expanded to look at its impact on alcohol and illicit drug use.
And your program targets students of what age range?
The program is designed to catch kids at the beginning of the risk period that typically is the beginning of adolescence. And so because this is a school-based program implemented in classrooms, we target kids in middle school, starting with the first year of the program in the 6th grade, and then 7th and 8th grade.
And how does it work exactly? What are the life skills that you are teaching?
Well, one way to think about this kind of prevention program, which differs from traditional drug education programs, is that rather than focusing on providing information about the dangers of using drugs, instead it focuses on positive youth development, and it attempts to reduce risk and enhance protection by focusing on a set of coping skills and general social skills that can help produce resilience in kids, make them less susceptible to external peer pressures or media pressures to engage in substance use, and then also to deal with the internal motivations to use these drugs by teaching them more adaptive coping skills.
It sounds fantastic. Can you give us an example of a specific skill that is taught?
Yeah, it teaches a range of skills. For example, with respect to personal self-management skills, coping skills, it teaches decision-making. It teaches things like how to cope more effectively with stress and anxiety by teaching them an array of cognitive behavioral skills such as...
So positive outlets for your stress?
Yeah, well, not positive outlets for your stress, but actually techniques that you can use that therapists have used in therapeutic settings that we in turn are using instead in a classroom setting, and we're teaching before kids actually have these problems. So we're teaching them how to cope with stress and anxiety through relaxation exercises, deep breathing, and even more recently through mindfulness exercises.
So interesting. And have you been able to analyze how effective it's been? I know that you say it's been very effective with the tobacco program, but have you been able to analyze how effective it's been with the alcohol and drug addiction?
Yes, across the board, it generally cuts drug use in half, tobacco, alcohol, illicit drug use, roughly in half. In some cases, it ranges up to as high as 80%. So we've been very excited by the results of the program. It also turns out, and this is important, it has durable effects. The effects last over time for as long as 10 years after the program's been implemented.
Right. Now, of course, every parent hearing this says, I want this program in my child's school. But if we don't yet have a program like that in our child's school, are there some tips that you can give parents for things that they can try and teach their children?
Well, one of the things that we found that's effective is that when you combine this kind of a prevention program, a school-based prevention program, with a family-focused program, it can actually enhance the prevention effects. So with respect to opioid use, a study conducted by researchers at Duke University found that they could reduce opioid use through the life skills training program that we developed. They could reduce it by 20%. But when combined with a family-focused program, the effects went up to close to 50%.
So clearly the family is crucial in this whole thing. So if you are from a family that doesn't have the advantage of having this program in the school, what would you recommend parents be on the lookout for or help their children to develop?
Well, I would recommend several things. The first and foremost, I would recommend that parents are good role models. You want to increase family communication skills. Parental monitoring is important, so you know who your kids are hanging out with, what they're doing, particularly at this critical middle school age. But also, parents should advocate for effective school-based programs. Most schools around the country are not using what are called evidence-based programs, programs that have been tested and proven to be effective. Instead, they're using programs that are either homegrown or programs that use approaches that have been found not only to be ineffective, but in some cases to be counterproductive.
And how many schools have your program right now?
I don't know the exact number of schools. It's implemented all across the country and in about 32 countries around the world. But unfortunately, it looks like the program is only in about 10% of American schools. So even though we're in schools in various states around the country, we're still only in about 10% of the schools. So we have a long way to go to encourage schools to use effective prevention programs. Programs like this are clearly underutilized, and they can have a powerful impact on all forms of substance use, but also, importantly, opioid use.
Absolutely. And parents who are interested in getting more information can go to your website, correct?
That's right.
All right.
LifeSkillstraining.com.
Wonderful. Dr. Botvin, thank you so much for being with us today.
It's my pleasure.